Hello guys, welcome to my channel once again. This Today we'll be talking about antibiotics. So we'll look at the general overview in the classification with their mechanisms of action and few examples under each class. So antibiotics generally is they are medicines or medications we use to kill bacteria, especially. It's different from antimicrobials, which are generally medications used against microorganisms. So medications against bacteria specifically are called antibiotics. So we have three broad groups of antibiotics. So I group them based on their mechanism of action. So the three broad categories of mechanisms of action include those that work on the cell wall synthesis, those that inhibit protein synthesis, and those that inhibit nucleic acid synthesis directly and indirectly. So these are the targets for the drugs. So if we are able to inhibit these things, we'll be able to kill or inactivate the bacteria. So the first group over here is those that inhibit cell wall synthesis. We know the cell wall of the bacteria protects the bacteria. So in that case, anything you do to damage the cell wall is definitely going to kill the bacteria. So these classes of drugs target the cell wall in one way or the other. So the first group over here is penicillins. So penicillins usually bind to a protein or a receptor on the cell wall of the bacteria. We call that protein penicillin binding protein. So they bind to that protein and inhibit the cross-linking of the glycopeptide by peptides. So we call the process transpeptidation. So they inhibit the transpeptidation of the cell wall. Therefore the cell wall will have defects in it that can attract water or transport water inside. Then the bacteria will swell and then break down. So in that case, that is what is killing the bacteria in this case. So they are mostly broad spectrum antibiotics. So any antibiotic that works on the cell wall synthesis is a bactericidal. That means it kills the bacteria. So that is mainly our target, to kill the bacteria, not necessarily to inactivate it. There are some antibiotics that just inactivate the organism. So penicillins kill the bacteria. So examples of such drugs over here, the common ones were amoxicillin, flucloxacillin, and ampicillin. Now the second group of drugs over here, cephalosporins, they work just like penicillins. They also broad spectrum. However, we have classes or generations of cephalosporins. So we have currently we have from first to fifth generation. So the first generation cephalosporin, an example I have over here is cephalexin. Then a second generation is cefuroxime. Then a third generation is ceftriaxone. A fourth generation is cefepime, and a fifth generation is ceftaroline. So when you go down the generation, the coverage for gram-negative organisms increases, and also the membrane penetration or lipid solubility of the cephalosporins also increase. That is worth noting about cephalosporins. But they work just like penicillins. Therefore, somebody who reacts to penicillin can have cross-reaction to cephalosporin as well. So the third class over here is glycopeptides. So glucose, peptide for proteins. So these drugs are made of combination of a glucose moiety and a protein. So the mechanism of action is they inhibit cell wall synthesis as well, but the way they do is different from the way the penicillins and the cephalosporins do. So they bind to the terminal group, which is the D-ala. So by so doing, they prevent transpeptidation and transglycosylation. So the glyco aspect prevents the transglycosylation, and the peptide aspect prevents the transpeptidation of the cell wall. So they are also broad spectrum, acts against gram positives. However, this drug is bacteriostatic against enterococci. So it can both be bactericidal and bacteriostatic depending on which organism you're talking about. So an example, the only example we have under that currently is vancomycin. So vancomycin we know is a drug they manufactured against methicillin resistant staph aureus. So usually that's what we use it for. Then we have carbapenems. So carbapenems also inhibit the cell wall synthesis by the way the penicillins also do. So they also bind to the penicillin binding protein to prevent transpeptidation. They are also broad spectrum, act against gram positive and gram negative. They are bactericidal as well. Then examples are meropenem and imipenem. Meropenem is quite common. So usually it's one of the strongest antibiotics we use in the clinic. If the patient is not responding to the other antibiotics, meropenem or meropenem is the last resort we normally use. So the second category of drugs or antibiotics is protein synthesis inhibitors. So the bacteria need protein to act. Therefore, if you inhibit the protein synthesis in the organism, it kills or it normally weakens the organism. So the drugs that weaken the organism we call the bacteriostatic. They do not necessarily kill. However, take note of this: aminoglycosides are bactericidal. They are the only protein synthesis inhibitors that are bactericidal. I said all cell wall inhibitors are bactericidal. So aminoglycosides are also bactericidal in addition to cell wall inhibitors. So bacteria have ribosomal subunits of 50S and 30S, unlike 60S and 40S in humans. They have 50S and 30S. So to prevent protein synthesis, the drug can either bind to 50S or 30S. So the first class over here is macrolides. So macrolides bind to 50S subunits of the ribosome in the bacteria, not in the human being or the one is being used to cure. So they also broad spectrum, act against gram negative and gram positives. But take note, they are mostly used against atypical bacteria. When you talk about atypical bacteria, they are bacteria that lack a particular typical character of other bacteria. So we can talk about mycoplasma, you can talk about legionella, you can talk about rickettsia, you can talk about chlamydia. So examples of such drugs are erythromycin, clarithromycin, we normally use in peptic ulcer disease against Helicobacter pylori. Then we also have azithromycin, which we normally use in respiratory infections as well. Then the second under the class over here is amphenicols. So under the they also act like the macrolides, binding to the 50S. So they are also broad spectrum against gram positive and gram negative. They are bacteriostatic as well. Then examples are chloramphenicol, thiamphenicol, azidamphenicol. So they all end in amphenicol. The macrolides end in tromycin. So if you see a drug ending in tromycin, it's a macrolide. So the next class over here is a lincosamide. They also act in the same way binding to the 50S subunit. They are mostly against gram-positives and anaerobes. So an example, the only example under that so far is clindamycin. You know, clindamycin is a drug we normally use. It has a very good penetrative power. It penetrates the bone wall, so bone infections or deep tissue infections, we normally use clindamycin, and abscesses as well. Then the next one is aminoglycoside over here. So aminoglycoside binds to 30S, unlike the first three. So it's normally against gram negatives and some anaerobes. I made mention earlier that they are the only bactericidal among protein synthesis inhibitors. So their names, most of them, their names end in mycin. So you have gentamicin, streptomycin, neomycin, tobramycin, except amikacin over here, which is not ending in mycin. But it doesn't mean any drug you see ending in mycin is an aminoglycoside. For example, clindamycin we saw over here was a lincosamide, it's not an aminoglycoside. Vancomycin we saw under glycopeptide was not an aminoglycoside, but it's also ending in mycin. If a drug ends in mycin, you know that the drug was extracted from a fungus. So tetracyclines, they also bind to the 30S subunit like the aminoglycosides. So they are also broad spectrum against gram-negative, gram-positives, and atypical. So the drugs acting against atypical organisms are macrolides and tetracyclines. So you should take note of that. So the examples also end in cyclin. So you have tetracycline itself, you have doxycycline, you have minocycline. So note these tetracyclines are calcium chelators. Therefore, these drugs are not supposed to be taken with dairy products or foods containing calcium. If not, their bioavailability or their absorption should be impaired. Now the last category is nucleic acid synthesis inhibitors. So we are talking about DNA synthesis inhibitor. So anything that prevents DNA synthesis inhibitor in the organism would inhibit the growth of the organism. So they are also bacteriostatic. They will not kill anyway, but they will inhibit the growth, because we know before growth can occur, we need to replicate or duplicate the DNA of the organism. So the first under this is nitroimidazoles. So these ones prevent DNA synthesis by disrupting the helical structure. So they bind to the strand directly. So they are direct inhibitors of DNA synthesis. So these drugs also act against anaerobes and protozoa. So examples are there. Their names also end in nidazole. So if you see any drug ending in nidazole, is a nitroimidazole. So common examples are metronidazole, secnidazole, tinidazole, normally used against anaerobic organisms. The second one is fluoroquinolones, also inhibit topoisomerase 2. So topoisomerase 2 is needed, we call it DNA gyrase. It's needed to unwind the DNA. So in this case, that unwinding is inhibited. So the DNA can be duplicated or replicated. So they normally act against gram negatives, and they are also bacteriostatic, and their names end in fluoxacin. So anything fluoxacin is likely to be a fluoroquinolone. So we have ciprofloxacin, levofloxacin, moxifloxacin. So take note again, fluoroquinolones like tetracyclines are also chelators. So they are not supposed to be taken with dairy products. And the chelators, they deposit in bones. So usually these drugs are not advisable in infants which who are having growth occurring. So usually when they take these drugs, the drugs deposit in their tendons and the epiphysis of the bone, and it may inhibit their growth. So care should be taken when giving tetracyclines and fluoroquinolones to infants. Then the last class were sulfonamides. Sulfur mean they have sulfur in it. So most of them they have sulfur in their names. So what they do is that they prevent folic acid synthesis. We need folic acid also as a prerequisite for DNA synthesis. So they do it indirectly by preventing folic acid synthesis. So they inhibit certain enzymes in the folic acid synthesis of bacteria. So bacteria can synthesize folic acid de novo, unlike we human beings that we can't synthesize. We need dietary folic acid. So these enzymes are not in human beings. That's what makes it easy for this drug target. So examples are cotrimazole, which contains trimethoprim and sulfur methoxazole. So it's a combination of two drugs. So trimethoprim and sulfur methoxazole. So the trimethoprim acts on dihydrofolate reductase. Then the sulfur methoxazole acts and inhibits dihydroterate synthase. These are key enzymes in the folic acid synthesis. So other examples are sulfadiazine and sulfasalazine. Any drug containing sulfur has a high protein binding or membrane penetration. So sulfur confers lipid solubility to drugs. So therefore these drugs are not supposed to be given to neonates, because they will bind to albumin, the little albumin they have, and displace bilirubin. So in that case, these drugs will cause or aggravate neonatal jaundice or hyperbilirubinemia in kids. So thank you for watching. That's the little I have for you on antibiotics. Like and subscribe for more videos. You can also order for videos on topics you want to be treated. Thank you very much.